Good afternoon. My name is Amy Neville. I'm a general surgery resident at McGill University, and I'd like to thank the HPBA for the opportunity to present this work, which, as you'll see, is the initial steps we've taken toward a larger ongoing project, which is the development of a classification system for biliary complications. As everyone in this room knows quite well, biliary complications have been considered the Achilles heel of liver transplantation for quite some time. And despite numerous advances in our understanding of the pathophysiology and risk factors of these complications, as well as refinements in surgical technique, they remain an important cause of post-transplantation morbidity. In fact, 1 to 3% of patients with a biliary complication will lose their graft as a result. Estimates of the incidence of biliary complications in the literature varies quite vastly, with estimated incidences ranging between 6 and 40%. And while this incidence is quite a wide range for a number of different reasons, one of the main reasons for this discrepancy or variation is varying definitions of what constitutes a biliary complication. Descriptions of biliary complication in the transplantation literature at present lack consistency and clarity, and at the present time there is no universally accepted classification system for biliary complications. Furthermore, there's no severity grading system for these complications at this time. Why are classification systems important? As we've all seen in recent years, in surgery we're moving toward increased use of classification systems for postoperative complications. And classification systems are important because they allow for consistent reporting of outcomes. This is important for evaluation and comparison of outcomes following transplantation, not only within our own institutions, but between institutions. Furthermore, it's essential in the evaluation and comparison of new techniques to ensure that we're all speaking a universal language and talking about the same things. And furthermore, as classifications become more refined, they can potentially serve as prognostic tools as well. Having identified a need for a classification system, we are proposing a structured classification system for biliary complications. And at the present time, our classification system applies to duct-to-duct anastomoses and is determined by the appearance of these complications on contrast cholangiography, mainly ERCP. This is our proposed classification system. As you can see, it's based on 4 main elements: stricture, leak, filling defects, and the appearance of sclerosing cholangitis. And we further subdivided these elements into sub-elements, if you will. The decision to make this classification was based on review of the literature as well as clinical experience. But as you can see, is obviously somewhat theoretical. So our goals at this point are to continue the development of the classification system and validate it. And the 2 steps that we're undertaking at this moment, and the first step is determining reliability, and the second step is validation. The remainder of this talk will be devoted to the first step, which is determining reliability, and the second step will be validation. In order to determine the reliability, which I'll talk about, we selected patients who underwent liver transplantation at our institution between 2004 and 2007, who had a choledochal anastomosis, and who had at least 1 postoperative contrast study. In patients who had more than 1 study, which was the majority of our patients, we considered the entire radiographic file in chronologic order. In total, we reviewed 104 films belonging to 35 different patients, and all of these films were reviewed by 2 blinded and independent reviewers. To get back to reliability, why is reliability so important? Number 1, it ensures that the system can be applied consistently. And it's also important because we know that in the interpretation of